Okay, so welcome to my live YouTube video today on sleep and hormones. I'm going to hit my camera here for my live stream for um, Facebook. So, welcome everybody to the Bird Island Wellness Facebook Live and YouTube Live. I'm doing two streams at once. And I'm here we're doing a very brief Q&A session on sleep and hormones. So first off, thank you for watching and thanks for showing up. I am here to answer questions. If you have any questions in the live feed, or if you want to post questions afterwards, we can do that as well. My name is Julie Kane, and I'm a nurse practitioner. I have a clinic here in Anchorage, Alaska, and as well, I am the owner of Bird Island Wellness, which will be soon to be taking patients, hopefully April 1st in Newfoundland. So welcome everyone. So first off, I just want to let people know why I'm doing this. My why as to why I am doing these live posts, live videos, is that it is my mission to educate people that are going through challenges that are related to health, where most of the answers are to a lot of these diseases and symptoms are lifestyle changes. So that's one of the biggest things. It's what I do. It is my passion. It's to help people just with simple lifestyle changes to help them improve whatever it is they're going through. I have big issues with big pharma and big food pushing their agendas. And as a healthcare provider, I feel like it is up to me and healthcare providers like me to help people truly get healthy. So with that, today we're going to cover just a few common questions that I think is beneficial for people to understand when it comes to sleep. And those questions are: why is sleep important? How much sleep do I need? How to improve sleep quality? And what are sleep-related hormones? So first of all, let's talk about why sleep is important. Sleep is important because it is when we sleep when our bodies recover and repair. So knowing this, it is crucial to good health and well-being throughout your life. Sleep, you could be a good sleeper and go through, a trauma or something stressful in your life where, your sleep has been affected. And that is kind of very common, but it is important to get your sleep back on track. So, you can go through periods of time throughout your life where sleep, has been great, but, now you kind of got to figure it out. So that's why sleep is important. Repair, recovery of your body. It helps everything function properly. So how much sleep do you need? So according to the National Sleep Foundation, adults ages 18 to 64 typically need about 7 to 9 hours of sleep. This can vary, obviously, and usually with older adults, they can, again, get more or less sleep. Some people, these are just averages. So some people can function with less sleep. Um, Very small percentage of the population can function on like 5 hours or less, and they feel great. They don't have any symptoms of poor sleep. So that's a small percentage of the population. And then there's people who need more sleep. So it's important to know kind of where you are in terms of how much sleep you need. Because again, like if you're pregnant, things like that, of course, sleep can be affected. But typically 7 to 9 hours is a really good number. So with that, going to bed earlier, certainly, if you need more sleep, that would be the easiest fix. So with that, segue into how to improve sleep quality. So, I am not a fan of sleep medication. I think prescription sleep medication can actually cause a lot of issues with sleep and can cause some dependency. So I am not I don't like to prescribe sleep medication. I think that it is needed for certain particular events in life, but I don't think it should be a long term fix. So, ways to improve sleep quality is to actually sleep to a very strict sleep schedule, even on weekends. So, if you go to bed at a certain time, 9:30, 10 o'clock, they say, to go to bed around 10 o'clock. That's when your body kind of is getting ready and you can actually get more REM and REM cycle sleep. So 9:30, 10 o'clock. If you go to bed later, obviously, then you sleep longer. So if you're getting up at 6, maybe you need to get up later at 7 to get that 7 to 9 hours. Um, Create a very restful environment in your room. I don't like televisions in rooms. I'm just being preachy, but I think that TVs belong in other rooms where you watch TV, not in a bedroom. And also with phones and things, put your phone in another room before you go to bed so that way you're not apt to look at it before you fall asleep. Um, Exercise. Exercise is great to help with getting good quality sleep. And, limit caffeine, limit water, limit caffeine to probably before 2 o'clock in the day. And then I told my patients, right around 6 o'clock probably is when you should have the last bit of water so that you're not waking up in the middle of the night. Another big factor to help improve sleep is actually alcohol. Alcohol, a lot of people think that alcohol can help relax you and help you fall asleep, but actually it interrupts your sleep pattern. So, limiting alcohol to maybe weekends only is probably a good thing. Again, it doesn't help with sleep. It actually disrupts sleep. So, limiting alcohol is definitely something to look at when you want to improve your sleep. So, that takes me to the final question that is very common out there with sleep, and that is, what are the sleep related hormones? So I do a lot of hormone replacement therapy. That's part of the thing that I do in my practice. And I talk a lot about two particular hormones, and they are cortisol and melatonin. So these two hormones are very interesting. So cortisol is actually our stress hormone, and that one is released in the morning when we wake up. It gives us our energy and things to kind of get us started in the day. And so you see a spike in cortisol levels in the morning. As the day goes on, your cortisol levels should actually fall. And that's what we see very common is that, as your day goes on, you don't need as much. So the levels slowly start to decline. If you are very stressed, if you work in a high stress job, if you don't get good sleep, this is where sleep is very important, your cortisol levels can be kind of all over the place. And that's also with shift workers, people who stay up all night. You've probably heard, they gain weight. Cortisol levels are kind of all over the place. So cortisol operates on a diurnal pattern. So very similar, like, you actually, when you sleep, wake up, that pattern, your cortisol levels go up and they drop. And it kind of keeps those cortisol levels normal. With poor sleep, with stress, those cortisol levels will be all over the place. And that's another factor with weight loss that I see with a lot of patients is that their cortisol levels are up and down. So, that I like to talk about with my patients is melatonin. Melatonin is a hormone, and it is one that you probably have heard about where people take melatonin for sleep. Melatonin is super important in our bodies. It helps with a lot of cell function, helps with immunity. It has tons and tons of benefits, not just for sleep. Um, and, depending on age, how your body is functioning, how you sleep, your melatonin levels can be low. Um, Taking melatonin at night to help sleep, it can help improve sleep. So it helps you get deeper, longer sleep cycles. And I do recommend melatonin. I don't recommend any supplements unless you've been seen by a provider. So this is just kind of me speaking um, in general terms, but I'm not here to diagnose or anything like that. I'm just here as a recommendation. And when it comes to melatonin, it is something, there's lots of varying dosages. So, you do want to speak to a healthcare provider before you decide to do any sort of supplementation. Melatonin, our bodies produce it, and levels increase at night before bed, right before we're ready to go to bed. And it helps us to fall asleep. So, with that, if you are using a phone or watching television, blue lights, things like that, if you've got like bright lights on in your house, it can actually disrupt your melatonin levels. So, in the evening, it's a good idea to turn down lights and, kind of chill everything out, turn the TV off a little bit early. So that way your body understands that it is getting ready for sleep. So, that is the hormone related piece with sleep. Um, with any hormone levels, and if you do suspect that you have a hormone imbalance and you've tried, to improve your sleep by doing all of the things and things still aren't getting better, it is worth your while to seek a medical provider to, look into your hormones to see if your hormones are balanced. They can help identify any underlying issues and hopefully provide all, an appropriate treatment to help with sleep. Personally, myself going through perimenopause, actually, we do see a lot of sleep issues in women and men that are hormone related, and they can be diagnosed, and hormone therapy can also help with sleep. So that is a big thing that I'm a proponent of, because without sleep, without getting a good night's sleep, you're basically waking up and you're already behind in the game. So, having good sleep is super important. It helps us be productive, keeps our energy levels up, um, immunity, all of the things. So, that's why I wanted to take the time and have this live little session about the importance of sleep. um, it is very easy to overlook the importance of sleep. However, getting enough rest is vital to your overall physical and mental well being. Um, right out the gate, without good sleep, you're waking up and you already feel irritated. You're already over caffeine. You're already eating more. So it is something where you really want to ensure that you're getting it right. So sleep to me is like a pillar of health. I put it right up there with eating healthy, exercise, all of the things. Sleep to me is just as important. So with that, thank you so much for watching and tuning in. You can actually put any questions. If you do watch the live session and you have any questions related to hormones or sleep, please add them below. I will look at the comments and respond. Um, As well, I do have a YouTube channel that offers tons of health related, lifestyle related things that you can do to help improve your health. That is Bird Island Wellness. If you're tuning in from Newfoundland, hi, it's only 1 o'clock in the afternoon here in Alaska. 6:34, I think, in Newfoundland. So again, so I will be having a live session next week. Not sure what the topic will be, but stay tuned for that. And I appreciate you all watching, tuning in, and take care and see you soon.